Good afternoon, everyone. Am I audible, ma'am?
Yes.
On behalf of Dentium, I warmly welcome to you all in today's Dentium webinar in collaboration with GPDPA on Bright Implant. This webinar will be informative and beneficial for those who are planning to start implants or like regular implant in their practice. We are privileged to have Dr. Avantika Tripathi, which is MDS and oral maxillofacial surgeon, and Dentium Keval, our esteemed speaker, that is bringing today in expert in technical knowledge and practical insight on the Dentium Bright implants. We encourage all participants to stay until at the end of the webinar to avail some special packages of the same of our implants and some our product. Thank you for joining. Now over to ma'am.
Thank you, Mr. Vipin, for the warm introduction. Good afternoon, everyone. So today's program is designed to give you a clear understanding of Bright Implant System. Basically, today we are going to discuss its unique features, clinical applications, and workflow that will make the system, this implant system, using this implant system treatment more predictable and efficient. So before starting, I would like to start with the question, what are the key factors that influence the implant selection? First is cost effectiveness for both doctor and patient, which means that it should be able to provide reliable clinical outcomes at an affordable cost. Next can be bone condition and case requirement. So it should be suitable for all type of bone qualities. Implant design and surface technology. It should enhance osseointegration and should be able to provide good primary stability. Surgical and prosthetic versatility, so it can be used in all type of cases like single implant case, multiple implant case, or full arch cases. Compatibility with the digital workflow, as all of us want a digital system these days. Everything is digital. So a system should be able to support the digital workflow. Ease of use and clinical predictability. It should be simplified. So it should not cause much of confusion in using the system. It should make it very, very simple and easy and more predictable. Personal clinical experience and comfort with the system. It should be user friendly and it should make the clinician more confident and should provide more clinical comfort. So considering all these points, a system was made called as Bright Implant System. So today we are going to discuss all the prosthetic options regarding the implant specifications of this system. It is mainly of two types, bone level and tissue level. Bone level implant has an internal hexagonal connection. The abutment is seating inside the fixture at a depth of 3.7 mm, which is its key feature, which provides an excellent joint stability to the system. So this is a very good depth at which the abutment is seating inside the fixture, which is going to provide an excellent joint stability. It is available in different diameters starting from 3.5 till 6. And as I told you, it has an internal hexagonal connection. The abutment interface means the internal diameter of the fixture is standard, which is 3.33. So it is standard for all. All the bone level Bright implants have a same internal diameter of 3.3. The length available in the system are starting from 7, 9, 11, 13 and 15. It has a double threaded design as of Superline, but the threads are more aggressive as of Superline. So they will bind with the bone better in a more precise and in a better manner. So they have a very, very long cutting edge, which is running on the entire surface of the fixture. So basically, what is the role of cutting edge? Whenever we are placing the implant, it does not exert much of heat on the surrounding bone. It just simply our implant will go inside the bone without causing much of stress on the surrounding bone. The surface treatment is same like Superline, SLA, sandblasting with large grits and acid etching. The titanium used in the making of Bright implant system is great for. The drilling protocol will be same as any other system. It will be like there is a guide drill of 2.5 mm. So if we are going to place an implant of 3.5, the drilling sequence will be 2.5 guide drill, then final drill of 3.5, and implant placement. There is no countersink drill like of superline, as the implant threads are more aggressive, so countersink is not required. And the difference in the drill design is that all the drills of Bright implant system are Lindemann drills. That means they are side cutting. They allow a more aggressive cutting of the bone. Coming to the tissue level implants, the tissue level implants are narrow. They have an external hexagonal connection and a dome shaped body. The dome-shaped body allows maximum amount of bone-to-implant contact at the area of cancellous bone. So, which increases more stability in the cancellous bone, in that area where we feel that the bone is very, very soft, minimum amount of bone is there. In the top surface, there is a thinner portion which allows for the marginal bone preservation. So it is going to provide better primary stability. The threads are again more aggressive of bright tissue level implant as well. The connection is 20-degree external tapered connection. Like a bottle cap, it is the abutments and all the prosthetic components are going to screw over it. It has a concave neck, contoured neck, which allows the soft tissue to adapt around the neck very, very nicely. Diameters available in tissue level implants are starting from 2, 2.5, 3, 3.5, 4, 4.5, and 5. So this tissue level implant is mainly created to allow placement in very, very thin diameter bone, especially in the lower anterior region or in the upper anterior region where the bone is very, very thin and we need to do bone grafting or ridge expansion in those cases. Then just to avoid that, just to avoid any secondary procedure, we can simply place a thin diameter 2 or 2.5 mm implant without doing any additional surgery. Length available are 7, 9, 11, 13, and 15. Yeah, and the platform diameter is standard for all, that is 3.8 diameter. So in all the diameter of implants starting from 2, 2.5, 3, 3.5, 4, 4.5, and 5, the platform diameter will remain the same, that is 3.8, to allow the prosthetic to become more easy and simple. So any abutment can be seated on any diameter implant because of the same platform. The gingival height is also standard for all. The gingival height, this portion is 1.5 mm for all type of implants. So this will also make the implant very simple and easy to use. There is also color coding like this. So this is the color coding of Bright tissue level implant system, and this is the color coding from here. This is the color coding of Bright bone level implant system. This is the prosthetic lineup. We'll discuss the prosthetic lineup in further slides. This is the tissue level drilling procedure. So if I want to place an implant of 2.5 mm, I'll follow the drilling sequence of 2.5, 2.5, and I'm going to place the implant. But if I want to place an implant of 2 mm, there is no 2 mm final drill. What I need to do is I just need to do cortication with a 2.5 mm drill, and I can place a 2 mm implant. So decortication with a 2.5 mm drill and then placement of a 2 mm implant. If I need to place a 4 mm implant, I need to follow the same drilling protocol. The drills are same for bone level as well as tissue level. So the kit will remain the same for both type of implants. It has a, as I told you, it has an external tapered connection. It has aggressive thread design. It has a dome shaped body, and the angle which the abutment is making with the external surface of the fixture is 20 degree. If I'm going to put a multi-unit abutment over a bone level implant, it will look like a tissue level implant. So the prosthetic component that I will be using over the tissue level implants, I can use it after putting the multi-unit abutment over a bone level implants, which makes the prosthetic workflow very, very simple. If I compare it with superline or inner line of dentium implants, then the depth of the connection depth of bright implant is much more deeper as compared to superline and inner line, which is 3.7, whereas in superline it is 2 and in inner line it is 1.6. The abutment screws of once we seat the abutment over the fixture, we need to tighten it with the screw. So the diameter of superline is 2.3, whereas that of inner line in bright is only 1.9, which means the more the diameter of screw, more torque should be given to tighten it. Lesser the diameter, less torque should be given. So if I'm going to finally tighten the superline implants, I need to give a torque of 30 to 35 mm. But while tightening a bright implant, I need to give a torque of maximum 20 to 25 NCM only. This is the surgical kit which we use for placement of bone level and tissue level implants. So the components of this kit is 2.5 mm first guide drill. The markings will be 7, starting from 5, 7, 9, 11, 13 and 15. This is the parallel pin. So after the initial drill, we are going to put the parallel pin to check the parallelism. After that, there are the final drills, which are 3, 3.5, 4, 4.5 and 5. This is the path pin, which is used to check whether my implant is parallel in alignment with the adjacent teeth or not. Or if I'm going to place two implants one after the other, they should be parallel with one another. So after inserting one implant, I'm going to put the path pin on it, so that then I'm going to start the other drill so that both the implants are parallel with each other. This is the drill extender, which is used to increase the length of the drill. So if I'm going to place an implant in the upper, let's say in the 1/7 region, immediate implant placement. So sometimes what happens is our handpiece touches the adjacent teeth and we are unable to reach the desired depth in the furcation area. So in those cases, we need to use the drill extender. This is the implant drivers which are used for the placement of a bone level implant. These are the implant, and this is the hex driver and the prosthetic driver. Basically, this driver is used with the handpiece. This is the tissue level implant drivers, which is used for the placement of tissue level implants. This is the ratchet, and this is the depth gauge. So the depth gauge has two ends. This end is placed along the wall of the osteotomy to check whether the implant drilling has reached the desired depth or not. If not, we need to change or we need to increase the depth. Sometimes in immediate implant cases, after removing the tooth root, we can measure the depth of the socket also with the help of depth gauge. So we always have to be very, very sure that if I have drilled till 11 or 13 mm, then my implant will also go till 11 or 13 mm only. Till the depth of the drilling an implant can go, it cannot go beyond that. So this is the tissue level implant. A tissue level implant looks like this. This much portion has to be out of the bone. This will be at the level of gums, and this should be visible above the gum area so that I can tighten my prosthetic component over it. So as I mentioned that if the bone, if I'm going to place an implant of 2 mm, I just have to decorticate the bone and then I can place an implant with a 2.5 mm drill, and then I can place an implant of 2 mm. Let's see a short video of drilling sequence of a bright bone level implant. So first I'm going to drill with a 2.5, then I'm going to drill with a 3 mm drill. So the drilling speed will be like of any other implant. It will be in the range of 800 to 1200 depending on the quality of bone. If the bone is soft, we are going to use the drilling speed of 800 or 900 rpm. If the bone is hard, we are going to use a higher speed of 1100 to 1200 rpm. After doing the initial drilling, we are going to insert the parallel pin to check the orientation, angulation and position of the implant. After that, we are going to do the final drilling of 3.5 till the final depth. Then after that, I'm going to do the 4 mm final drilling. Then implant placement. So the implant placement has to be done with the implant drivers. Bone. So this is a bone level implant. So I am using a bone level implant driver. So the implant is gradually inserted inside. So the maximum speed that I can use for my implant insertion is 50 rpm. It should not exceed beyond that. After complete insertion of the implant, I can put a path pin to check whether it is in proper alignment with the adjacent teeth or not. Complete the procedure, I need to put a cover screw from the top with the help of hex driver. Once the cover screw is placed, if this is a patient, I'm going to suture it and then my procedure is complete. So this is a case of implant placement using the surgical guide. Dentium's bone level bright implant placement using a surgical guide. So there is a surgical guide also available with Bright system. So first of all, we are going to remove that tissue from that area with the help of tissue punch. Then we are going to gradually increase the start preparing the osteotomy with the help of the liniment drill and then the final drills. This is 3.5. As we can see, there is a yellow band on the neck of the drill. So that means it is a 3.5 mm drill. Then we are going to insert the 4 mm drill, then 4.5. And after that, we are going to place the implant. This is the bright bone level implant through the surgical guide. Once the implant is placed, then we are going to insert we'll remove the surgical guide and we are going to tighten the cover screw. And then our procedure is complete. So after 3 months, when the patient will come, what we will do, we are going to remove the cover screw and put a healing abutment. So after that, after 1 week, we are going to remove the healing abutment and tighten the digital abutment over it. So the digital abutment comes up with a delivery holder. We are going to there is a hole on the top of delivery holder. We are going to pass the screw through it, tighten the digital abutment completely, and then twist the delivery holder and remove it. Then this digital abutment can be scanned completely. The scan data is sent to the lab. They are going to prepare a crown on it and they are going to send us the crown that we can deliver in the patient's mouth. So the prosthetic lineup for bone level implant is so there is a digital abutment, TI base, healing abutment, screw abutment, and a TI blank. So we all know about cover screws and healing abutments. Cover screw is standard. As I told you that the internal diameter of the fixture is same 3.3. So the cover screw will be one type. It is compatible with all diameter of implants. Healing abutment is also there available in different diameters, which is 3.8, 5, and 6.2, available in different height and different gingival heights as well. These are the, if we want to go with the manual method, we can use impression coping. So these are the pickup and transfer impression copings available. This is the digital abutment. So this is a final abutment and it is scannable. So it can be used as a healing abutment. It can be used as a scan body. It can be used as an impression coping for snap-on impressions, and it can be used as a permanent abutment also. So from healing to final prosthetics, it is solved with only one abutment. So after doing the patient, after placing the implant, we can put this digital abutment into the patient's mouth. We can scan it. We can send the data to the lab. They are going to prepare a crown on the same abutment. So for that 2 or 3 days, we need to remove the digital abutment from the patient's mouth and put the healing abutment. Otherwise, this digital abutment is going to serve all the purpose. So as I mentioned that this digital abutment comes up with a delivery holder. So this white portion is a delivery holder. Many doctors get confused that this is a scan abutment, like this white portion is scannable. No, it is not scannable and it is not an impression coping also. This is simply a delivery holder. We can simply screw, there is a hole on top of it, so we can simply pass screw from it and we can tighten it with the hex driver, and then we can simply twist this plastic thing and we can pull it. Now this portion has to be scanned. Next abutment which is there in Bright system is TI base. So TI base is available in two diameters, 3.8 and 5. There is a slot cut, there is a side cut on the top surface of TI base. The advantages of this side cut is, if we are going to place an implant at a slight angle, and suppose I place an implant at 15-degree angle, and I want, and my screw hole is coming labially now, but I want that it should not come labial, it should be lingual. So in those cases, I'm going to use a TI base, and through this slot, I'm going to pass my angled screwdriver. So from the palatal area, I can reach to the labial side. So for that, we have to use the angled hex driver only. If I'm going to use my regular hex driver, that will not serve the purpose, because I need to reach from the palatal till the labial access hole, but till the labial screw, but the screw's access hole will be on the palatal side. This is the slot which I was talking about, this one. So in interior cases mainly, where we expect that some tilt can be there in those cases, so this will allow us to improve the aesthetics in interior cases by covering that screw hole on the labial side and shifting it to the palatal side. This is the screw abutment and this is the angled screw abutment. So screw abutment is available in single diameter of 3.8 and the angled screw abutments are available in a single angle of 15 degree. This is the titanium temporary abutment for fabrication of any temporary prosthesis. This is the TI blank which is used for the fabrication of a customized abutment. This is the lab analog. So in Bright system, as everything is made considering the digital perspective, so this analog will serve both the purpose. This is a manual as well as a digital analog. So if anybody wants a digital analog, that is also, then also they have to take this one, and a manual analog is also this. If we need to place an implant of a tissue level type, then what we need to do is the surgical protocol will remain the same. The drilling protocol will remain the same. Only the implant placement will be done with the help of a tissue level implant driver. So this is the tissue level implant driver. So we'll simply pick up the implant and we are going to gradually insert it inside the osteotomy. Once the implant is inserted, then we are going to remove. Now, if you can see this, there is a white color cap on the top of a tissue level implant. This cap, white silicone cap, has to be removed with the help of extraver, and after that we can put a comfort cap over it. Like we put comfort caps on multi-unit abutments, so we have to put a comfort cap on the tissue level implants also similar. Once the comfort cap is placed, then my implant is ready. On the bone level implant, we put cover screws, whereas on the tissue level implant, we put the comfort cap. So if I need to place an implant, immediate implant placement has to be done in this 2-2 region. Then what will I do? I will extract the tooth atraumatically. Then I am going to place an atraumatic extraction of the tooth. Then with a single drill of 2.5 mm, sorry, with a single drill of 2.5 mm, I am going to place an implant. If you feel like the bone is soft, if you feel like the bone is less, then you can skip one drill and then you can place an implant one drill short. After complete placement of implant, we are going to put the comfort cap and we are going to suture that area, and we can give an immediate temporary prosthesis also after completion of the procedure. Now we can give a final prosthesis after 3 months. So this is a patient in which the bone height was width was very less. In this patient, a complete trapezoidal flap was raised, and as we can see, the bone diameter is very less. Then we are going to do the drilling. So a single drill implant placement. So with a single drill, I'm going to place a 2.5 mm implant. Once the implant is placed, I'm going to prepare some corticotomies. Then I'm going to prepare the flap. Once the flap is prepared, I'm going to extract some autogenous bone graft from the third molar region. Once the autogenous bone graft is collected, then I'm going to place it over the implant site, and I can bulk it with the artificial bone and then I'm going to put a membrane and stabilize it with membrane pins and suture it. Another case in which I placed 2 bright tissue level implants, two teeth were removed, the area was cleaned nicely. All the granulation tissue, as in the pre-op x-ray, we can see that there was a huge amount of granulation tissue underneath the teeth. So I'm going to remove the granulation tissue nicely, and then I am going to place 2 bright tissue level implants. I'm going to pack it with the bone graft and stabilize it with membrane. So this is a case in which 2 bright tissue level implants were placed and the prosthesis were given. Now let's discuss about the tissue level implant prosthetics. So the tissue level implant prosthetics include digital abutment, TI base, TI blank, and a comfort cap. Comfort cap is mainly placed on the fixture immediately after the implant placement. So once the implant is placed, like in bone level implants, we put a cover screw or a healing abutment. In a tissue level implant, we put a comfort cap. We can choose the height of the comfort cap according to the case. If we feel like the soft tissue thickness is more, we can choose a larger height. Otherwise, we can choose a smaller height of comfort cap. Impression components are also available. Impression copings. This is the pickup impression coping and this is the transfer impression coping. If we want to go ahead with the manual method, we can choose this. We can use these impression copings. TI base, as I showed you in bone level implants, there is a TI base. The purpose is same. It has a side cut which allows to shift the screw hole from labial to palatal. We can access the labial screw from the palatal side with the help of an angled hex driver. This is the digital abutment which we can place, which we can scan, which we can, after scanning, we'll send the digital abutment in data to the lab. They'll make a prosthesis over it and we are going to deliver it on the patient. So this is also acting as a scan abutment. This is the titanium temporary abutment which is used for the fabrication of temporary prosthesis over the tissue level implants. This is TI blank which is used for the for a customized abutment basically. So digital abutment is serving, it is basically based on the one abutment concept, which means that the healing abutment, scan abutment, impression coping, snap-on type and a permanent abutment, all the features this single abutment is serving. In conclusion, if we see the entire prosthetic workflow step by step, it will be, if I need to do a single or a multiple implant case, except full mouth cases, then first of all, I need to place the fixture with the cover screw or with the healing abutment. Then if I'm going to go with the analog method, then I'm going to place the healing abutments. Then I'm going to make the impression with the impression copings. I'm going to use the lab analogs and then I am going to prepare the abutment, prepare the crown with the help of a digital abutment or a TI base. If I am going to go ahead with the digital method, then I am going to place the implant, put the healing abutment. I am going to use the lab analog and I am going to place the digital abutment on the patient's mouth, scan it, send the data to the lab. They're going to make a prosthesis and I'm going to use the same analog, which is also a digital analog, during the fabrication of prosthesis. So along with this digital abutment and this lab analog, both these components have to be sent to the lab. If I'm going to go ahead with a single or multiple implant case tissue level, except the full mouth cases, then I'm going to place a fixture with the scan comfort cap, impression copings, lab analog, and final crown can be made with using the digital abutment or TI base. If I'm going with the digital method, I'm going to place the fixture with comfort cap, lab analog, and scanning is done with the digital abutment. Or I can use a TI blank after scanning the digital abutment. Either I can make the prosthesis on the digital abutment or I can use TI blank to customize my prosthesis if I want a customized abutment. If I want to go ahead with the full arch cases and the implants are placed straight, then I will follow the previous protocol. If my implants are tilted, then what all options do I have? In bone level, I'm going to place all the implants, some tilted, some straight. Then I'm going to put healing abutment on all of them. I'm going to put impression copings on all of them, make the impression. Impression will go to the lab and the lab person is going to scan it. Once the scanning is done, then I am going to tell the lab person to make a customized prosthesis using TI blank, because right now we do not have any angled abutment above than 15 degree to if I have placed an implant at a 25 degree or 30 degree angle, then I can only fabricate a prosthesis by using a TI blank. Other than that, I do not have any option. If I am going to use a bright bone level for full arch cases using digital method, and if I am going to place the implants tilted, then I am going to place the fixture with cover screw healing abutment. I am going to use the digital abutment for scanning, which will the data I'm going to send to the lab along with the lab analogs, and I'm going to send TI blank for the customization of the prosthesis that will do the angle correction as well as complete customization of the prosthesis. In tissue level implants also, if I'm going to use the analog method and I'm going to place the implants in a tilted manner, then I'm going to follow the same protocol. After making the impression will go to the lab and the lab person is going to scan it. After scanning, he will follow the complete digital protocol. He will customize the prosthesis using the TI blank. So whenever we have to, in full arch cases, whenever I'm going to place implants in tilted fashion, I need to use TI blank to do the angle correction. Right now, the angled multi-unit abutment that we have for tissue level, for bone level implants is only 15 degree, and for tissue level implants we do not have any angled abutment. So all the angle correction that can be done only and only with the TI blank. This is the fixture with the scan comfort cap. In this, either the scan comfort cap can be used for scanning or the digital abutments can be used for scanning. Then we are going to use the lab analog, and then we are going to send TI blank to the lab for the customization of prosthesis. For temporization, we can use bone level or tissue level temporary abutments. The company also has overdenture components for bone level and tissue level. For overdenture, there are positioner abutments, ball abutments, implant keepers. Implant keepers are of two types, dome type and flat type. So whichever is whichever you are comfortable for your case, you can use that. In tissue level also, we have positioner abutments, ball abutments, and magnetic attachments. As I mentioned, that this white portion which is there over the digital abutment is a delivery holder. So this should never be scanned. This is only and only to hold the digital abutment seated properly in the patient's mouth and to tighten the screw through it. It is not for scanning purpose. Dentium also has a YouTube channel which has multiple product related videos. If you have any queries regarding bright implant prosthetic workflow or bright implant kit or any query regarding other implant systems of Dentium, you can visit their YouTube channel and watch those videos. Thank you so much for your patience listening. If you have any query, you can ask.